diabetes is a complex condition, a chronic condition. It changes over time. So education and ongoing education is essential. So what I'll say to somebody at the beginning of the journey, in the middle changes, and towards the end changes yet again. Mm-hmm. And so on, depending on what's happening. And the second thing is the home glucose monitoring. It's really important if you are on insulin or on certain drugs that can cause low sugar reactions, that we have some glucose monitoring, because that's the best way we have to adjust that treatment. Now, for your group of people is a big problem, because you have not been approved like the type 1, and this has already come up a couple of times. When we talk to NDIS, it has to be about the disability. So if the carers that are coming in to help a person with mitochondrial and diabetes don't really understand low sugar reactions, it can put you at risk. So its understanding is not about managing diabetes, because the NDIS does not support the treatment. It's not about managing, the diabetes. It's about managing the disability and how you write and request your care plan to be changed. But you're going to need evidence, and that's where your GP, your endocrinologist, and even in the services that you attend for diabetes are important to give you a letter that supports that. We cannot say that a patient that has MELAS has got type 1 if the antibodies are not positive. So when we say a person has got type 1, there are certain things that we look at.
Yeah. I mean, certainly the vast majority of people with type 1 diabetes do have an underlying autoimmune condition. We need to establish absolute insulin deficiency before we make a diagnosis of type 1 diabetes. And that's something that I guess your GP and endocrinologist are responsible for. Mm-hmm. And if it is that you're completely insulin deficient, then there is stronger argument to adjust certain sort of registrations with the NDSS so that you become classified for all intents and purposes as having type 1 diabetes, which then allows access to things like subsidized CGM at the moment. Now, these things are going to change, and it certainly has changed relatively recently. It was up until July not fully subsidized for type 1 diabetes CGM. There were certain subgroups of people, and then that expanded. So likely over the next year, 2, 3, 4, 5 years, in fact, there are going to be ongoing changes into who can access things. And I guess it's always difficult to say when that's going to happen. But in the meantime, I guess my advice would be to work with your local doctor or with your endocrinologist to sort of make sure that you're being classified appropriately for your type of diabetes. And that if you can, as Maria was saying, in any NDIS application, focus on the benefits it will have to you, not from a disease management perspective, but from a disability management perspective.
And this is where the foundation, I suppose, will come in, because people power works. Look at type 1. It took a long time to get there, but it just what do you call it in English? The aligned.
Alignment.
Things aligned. The stars aligned. That's what I couldn't remember. The stars aligned, and therefore it happened. But it took a long time, and so the foundation is going to be really important at doing that. And the other thing I want to say is, I think in a lot of people with mitochondria, the dietary reviews are very important as well, to make sure that you're not undernourished and that you are able to your body to work. So regular reviews with dietitians, I think, is important, as long as you find one that you can talk to and really help you with those things.